Hello, I'm Dr. Vanita Rattan, a medically qualified doctor and a cosmetic formulator specifically for skin of color. Today we are talking about pregnancy stretch marks. Now, I remember when I was pregnant, the only thing I was worried about lots of different things actually, but one of the things that was really on my mind was stretch marks. I really did not want them and I wanted to be able to wear my bikini later on in life, and that was actually one of my legitimate concerns. So I have researched stretch marks, and actually I formulated something for myself in the lab, and I've had 2 kids and I didn't get stretch marks, and I'm going to be teaching you my secrets in this video. So some of the lies you've been told so far is if you just keep moisturizing, you won't get stretch marks. Well, that's not true, because if you just keep oiling the outer skin, you're not really penetrating into the dermis to stimulate collagen, and that's where tears happen. So yes, you're softening the skin. Yes, there's some kind of a little bit of stretch, but especially in that 3rd trimester, you are expanding rapidly, and you almost need to be manufacturing collagen at a rate that is going to prevent stretch marks from happening. So a little bit of emoliation is good, but it's not going to prevent stretch marks. The next thing you're told is it's just genetics. There's nothing you can do. That's also not true. My mum has loads of stretch marks and she's got fantastic skin, but actually there are things you can do to help yourself. And my personal favorite is stretch marks are permanent. Once you get them, you are stuck for life. Actually, what you can do is to help your skin and to minimize the appearance of stretch marks after you get them. So this video is predominantly going to be focusing on preventing stretch marks and what you're doing during pregnancy. I've actually made a whole other video for you on stretch marks, what you do once you've already got them, and after the pregnancy when you can wear retinol and retinaldehyde on the skin. Just a little hint in case you don't have time to watch that video, these 2 are not pregnancy safe products. So in here, but this is what you do after you have children and you've got stretch marks. So this is your body exfoliator plus body oil. In your body oil, you've got a higher strength retinaldehyde plus your tetrahexyldecylascorbate of fat soluble vitamin C. Those stimulate collagen. Here, this is your body exfoliator. You actually put this product on first. This is your lactic acid, salicylic acid, gluconolactone. So that's to almost take off the top layer of dead skin cells so that you have the actives to then penetrate with the oil. In here, I've also loaded it with tyrosinase inhibitors itself. So I've actually put in azelaic acid, octadecanoic acid, niacinamide, ascorbic acid. It's also got retinaldehyde in it as well. These 2 combined are fantastic once you've already got stretch marks and you've had your kids and you've done with your breastfeeding, you can move on to these products. However, if you are pregnant and you want to prevent it from happening, these are not your products. So now you're thinking, Dr. V, what's actually happening to my skin during pregnancy? So what's happening is your skin is literally tearing apart at the deeper layers. So the collagen and elastin fibers are snapping. And if you've got skin of color, you're at an even higher chance of getting PIH, post-inflammatory hyperpigmentation, which means after the stretch mark has healed, they can leave behind dark and uneven scars, and that can last really for years. So what can you do about it? Because shea butter alone is not gonna do much. So in this video, these are top 10 questions that you guys have Googled that I will be answering. When these fibers rupture, so the collagen and your elastin, the skin starts to tear apart from the inside and then out. That's what you're seeing. The body tries to repair it, but the result is basically thin, disorganized collagen fibers. That's what leads to stretch marks. Now, the thing that makes it almost worse for us during pregnancy is that your collagen breakdown accelerates, because what happens is we have higher cortisol levels, and this leads to faster collagen degradation. That's why you are more likely to get stretch marks during pregnancy than if you, for example, were to gain the same amount of weight. And the reason you're more likely to get hyperpigmentation is because during pregnancy, because your estrogen and progesterone are high, your melanocyte, the cell producing the pigment melanin, is more reactive to any form of inflammation. So when you are literally ripping the fibers apart, you are triggering your melanocytes simultaneously. So the key actives I want you to be using on your abdomen during pregnancy is 2% 3-O-ethyl ascorbic acid. That is your water-soluble vitamin C in the therapeutic index. The mechanism of action is, what it does is vitamin C is essential in order to boost collagen production. This is why we tell you, even when you're drinking collagen, even our collagen boost, we put vitamin C in it because you need vitamin C in order to manufacture collagen in the body. The second thing vitamin C does, it reduces PIH, post-inflammatory hyperpigmentation, because it's a tyrosinase inhibitor. The third thing it does is it protects from oxidative damage. So even when UV rays hit the skin or any kind of irritation to the skin, we have an oxidative stress. But what you want to do is mop up those damaging free radicals, because free radicals damage the collagen. So that's how vitamin C works. It's an antioxidant. It protects you. This clinical study shows a 2% vitamin C derivative increased collagen synthesis in 8 weeks. So again, you do want to use the skincare for 3 to 6 months to see results, but minimum 2 months. So what does vitamin C pair really well with? It pairs well with niacinamide. So what niacinamide does is it boosts the antioxidant effect of the vitamin C. It also pairs really well with peptides because peptides help to rebuild collagen structure. You also want to pair this with ceramides, especially for skin of color. Ceramides are the fats in the skin. And the way ceramides work is that it creates a healing environment for the skin for all the other actives to work well. And if we already have less ceramides in our skin, we are more prone to the skin ripping from inside. So we want to reinforce the skin's elasticity and its barrier with ceramides. The other active I love for us is 1% octadecanoic acid. It's a tyrosinase inhibitor, and it's going to help to reduce any hyperpigmentation from the stretch marks itself. In addition, it's an anti-inflammatory, so it helps with the redness and the initial irritation that's taking place. The other active we should be using on the body, not just the face, is bakuchiol. Bakuchiol will increase cell turnover, and this is going to help you significantly when it comes to preventing stretch marks and just making sure that the skin cells aren't getting stuck at the top and that we're getting nice, juicy, healthy skin cells turning over quickly. The other active that a lot of us are already using on the face, but we should be using on the abdomen during pregnancy, is your Centella asiatica. It's actually a multi-benefit product, a multi-benefit ingredient. Number one, it's a tyrosinase inhibitor. Number two, it's anti-inflammatory. What it also does is increases fibroblast activity. So this helps to speed up skin repair. It also helps to boost collagen synthesis. So this helps to keep the skin firm and elastic. The problem is this combination didn't exist for pregnancy. And so I created the world's first pregnancy stretch mark cream for skin of color. These are the actives that we need on our abdomen during pregnancy. So let me show you. I'm so excited about this formula. So this is how it comes out. So it's nice and rich, but not so rich that it's difficult for you to rub in, because I don't want you to have to tug too much at the belly, but we need enough fats in order to make sure that the ceramides are there. So when you're putting on an oil, we are only getting one phase of actives. When you put on an emulsion, you're getting 2 phases of actives. You're getting the water phase and the fat phase. And so let me tell you the actives we've put into this. So of course, I put in 2% 3-O-ethyloscorbic acid, your vitamin C. I've put in 1% octadecanoic acid. I've put in your 2% niacinamide. I've put in your bakuchiol. I've of course put in your ceramides and your peptides to create a healing environment for the skin, and of course your Centella asiatica. This is a fragrance-free formula, and it's in an airless pump in order to make sure that all the antioxidants are stable when you use them. I actually made a video on bio oil years ago. Bio oil is the #1 product right now for stretch marks. And when I made the video, I was shocked to learn that it contained vitamin A, retinol palmitate. It's a blanket no when it comes to vitamin A during pregnancy, just like it's a blanket no on using, Botox during pregnancy. We just say no to it. And I think because it was the only product on the market and it had this first mover advantage, and it was the only thing that, people were using, it sort of became the industry norm. But when I looked into it, it was loaded with fragrance, it contained vitamin A, and it didn't contain any collagen stimulating actives. And I remember years ago learning this and thinking, one day when I'm ready, I am going to make the most epic stretch mark cream that I wish had been made for me. And that is what I've done today. And I'm so, so proud of this product because it's a product that I wish I'd had. And instead, I was grappling myself. I was creating different formulas for myself in the lab. But if someone had actually done it for me, my life would have been so much easier. So if you're going to a baby shower or you yourself are pregnant, the best product you can give, if you're just gonna get one thing, is this. This is gonna be such a game changer for that lady's future and her confidence in her body. If you haven't already seen my other video, I've created also the world's first anti-aging serum for pregnancy. We are getting pregnant later and later. So we have, education that comes first, and then we have our careers and our businesses. And so we tend to put off getting pregnant later. Now, the average age of the first pregnancy is 31 years old in the United Kingdom. And by this point, we've already started retinol because we're losing 1% collagen every year from our mid-20s onwards. And we may have started Botox, and you have to stop both during pregnancy. And so I was thinking we need anti-aging products, and every anti-aging product in the world contains retinol or some form of vitamin A. And so I thought, I'm gonna make it, and I'm gonna make it amazing. And I'm gonna make sure there's loads of tyrosinase inhibitors in there to help us with hyperpigmentation. And that is what I did with this. It's the other formula I'm so proud of. I'd like to show it to you. So in here, I put in 2% niacinamide, so it comes out a little bit yellow, very light on the skin. 2% niacinamide, 2% tetrahexyldecalascorbate, that's your fat-soluble vitamin C. I've put in 2% peptides in order to help stimulate collagen as well. I've put in your 3-O-ethyl ascorbic acid, so that's your water-soluble vitamin C. It's gonna help to work in the epidermis to brighten the skin. I've also put in bakuchiol, which works very similar to retinol, but is pregnancy safe. I've put in coenzyme Q10 to boost the effects of vitamin C. I put in phytic acid, which is anti-hyperpigmentation. Of course, I put in licorice root extract because that pretty much goes into all of my brightening products. And of course, glycerin, because our skin becomes drier during pregnancy. So even though I made this product for pregnancy, it by accident also became the best vitamin C product on the market just based on the ingredients list and the packaging. And so I actually use this as my morning vitamin C serum now to brighten my skin. But I made it specifically for my pregnant ladies who are already struggling. Your heart's already going a million miles an hour. You can't fully breathe. You don't feel 100%. Your feet are killing, but I want your face to feel amazing. So I hope you enjoy this as well. So if you are going to a baby shower, this is the product to get, because we always get things for the baby, but I'm not being funny, but the mum is going through a lot. So get the mum something too. So now that you are pregnant, you have to move from your chemical sunscreen to your mineral sunscreen. So watch the best mineral sunscreens on the market.